Catch Catalyst Pharmacy podcast host Jeff Key at this year's NCPA annual convention. If you're interested in keeping the doors of your pharmacy open, don't miss the second general session and Jeff Key talk about the 5 ways to run your pharmacy out of business. Happy birthday to PioneerRx. Join us Sunday from 2 to 4, booth 313, in celebrating 15 years and toast with us.
What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. So Amita and the Avant team has really kind of built out a lot of trial and error over the years and working with physicians. And that a lot of that, I'm sure you're able to share directly, through personal experience with CPESN network. Also want to talk a little bit about what you guys do just in collaboration with other pharmacies at Avant, because you guys, again, so many times we see that, independent pharmacies have that service mindset and that service to industry and others within the profession. Even, a competing drugstore down the road, there's still this kind of camaraderie. So I love what the Avant Institute has done for just the profession and other pharmacies by sharing so much of what you guys have learned along the way.
No, that's you said that very eloquently, actually. I think when we look at, our industry as a whole, right? Yes, there's going to be challenges where you do have your competing interests with other mom and pop or other small pharmacies or other independent pharmacies or large pharmacies that are in the area, right? The business is what the business is, but at the end of the day, you're absolutely right. There is a camaraderie to help support your fellow independent community pharmacies. So what I love about the Avant Institute, I remember when I came on board and I learned about the Avant Institute, and I kept asking Mina, I was like, how did this brainchild really come to be? Because I was just so confused. I'm like, you're an independent pharmacy owner, and now you're going out and you're teaching other pharmacies how to do this. And the way that it was described to me was not only did it come out of Olivia Bentley, who was with us for the longest time, and now she's actually doing some really great things in serving as executive director for the medical practice. But she's also, engaged in the pharmacy space and a lot of the things that we're doing here. And it was that continued engagement that they both had that they realized we've got to create a pathway for which people can get a hold of us that we can formally teach and train folks. Because this one-off phone call at midnight with, intern pharmacy owner here, or this pharmacist that heard about a program or heard a podcast or whatever it is, it became too much. And then people were coming to the pharmacy saying, hey, I want to learn how you guys do this. And the pharmacy's like, we've got scripts to fill. We got patients coming through the door. Oh, gosh.
So I bet every podcast, Amina's LinkedIn just blows up.
Probably so, yeah. So really, the Institute was born out of that passion to educate and train other pharmacists, but out of necessity as well, too. And I really think that we joke all the time because we thought the small little just kind of side project idea that was going to be something fun to do, that we were going to get to connect with other pharmacies, has really turned into this truly remarkable educational institution that has been created. And the team that we have there, it is one of my most exciting parts of my job, is being able to be a part of the Avant Institute and the work that we're doing there. It started, Will, like you mentioned, it started with just teaching and training independent community pharmacies and then pharmacy owners and then pharmacists and then clinical pharmacists and then anybody that really wanted to come. We've had all walks of life. We've had nurse practitioners come through and go through the training programs of what we call the ALI, the Advanced Learning Immersion Experience. And so that 3-day course was kind of the bread and butter of what the Institute was offering. But as you've probably heard and you've seen, we've expanded what we've done tremendously to now having online courses, to we just had the business of collaborative care symposium, where we had so many folks come in, previous alumni of our program and stuff come in. So it's been really exciting to see that growth. I'll be honest, probably one of the most exciting things to me is two parts. One, we saw the need to educate and train pharmacists at a younger phase of their career, that we could kind of get them to be exploratory with us, right? Those pharmacists that are coming out of pharmacy school, it's great to kind of have a clean slate. A lot of times they don't know what they don't know. So you can kind of get them in and learn and see. And that's really where, we want to see the profession growing. And this stuff isn't taught in pharmacy school, right? So we saw that need. And so we had collaborated with other entities before and having residency programs and fellowship programs and things like that with an institution. And they were great. We have great relationships with them, and that was good. But because we're such a complex entity, and because we're not good at fitting in a box, we're not good at being in a box. And so we needed more flexibility to what we needed to do. And that actually was what became the birth of the fellowship program that we have. And so we have the fellowship program now. We're in, technically, I would say, our third year of the program, or fourth year if you include the initial year where we were kind of piloting this with an institution, and bringing that together to say, hey, this is where we're at. This is the opportunities. And what's been exciting is last year and this year, we went from being an internal program where we had fellows just come and work with our clinic sites and practice sites that we had here in Charlotte. We expanded it nationwide. And so we've had collaborating pharmacies, whether we've taught or trained them in the alley, or they've, heard a podcast or been to a training, or they're engaging in these services and they need that support. They're the ones that now they have a fellow. So we've expanded it to both internal and external fellowship sites. And man, well, that has been one of the coolest things to see. And one of the coolest things I think we've done at the Institute is engaging folks in that way, and really kind of shining the light for other pharmacies to be able to engage in these service sets and to engage in this capacity. Because at the end of the day, again, Avant, we're just one entity. We cannot be the only one doing these things, because if we are, it's great and it's novel and we're helping ourselves locally and we're good. We're doing what we're doing. We're good. But if we're going to get to payers, if we're going to get people to see that pharmacy's making an impact, we can't be an N of one. We need to be an N of 100, 300, 500, 1,000, right? And that's where I think really CPSN and the value that CPSN brings is it helps shed a light on what are the things that our independent pharmacies are doing to then help us get to payers, right? Help us get to those local payers statewide, and then other bigger payer opportunities to do that. And so I love what the Institute has done to offer these training modalities and both what we've done previously and what we're doing now. The other exciting thing I think that's been really kind of, it's like you just kind of have those like, oh crap, I can't believe that, we're doing this, is about a year and a half ago, we were connected with a group called DAC. They're the Davos Alzheimer's Collaborative. And with our partners at CogniView, we were actually able to collaborate to write a grant to support a project where we actually did screenings for early detections of Alzheimer's and dementia. And so the idea was, how do we engage with our partners in CogniView to get their CogniView screening machines into pharmacies to screen patients? And that was kind of the gist of the grant, to see what the opportunities were. We're little independent community pharmacy with a little independent educational arm here. We really didn't see that this was going to be something that was going to necessarily develop and grow, because we had folks like the Cleveland Clinic, Aurora Health, all these big entities, and this was a global initiative. So there are other collaborators that were applying for this grant across the globe. Well, lo and behold, we were selected as one of 12 sites to participate. Our grant was selected as one of 12 sites to participate. So, wow. It's just so cool to see that these things are happening. And you're like, how did this happen? How are we getting these opportunities to do this? And it's been one of the coolest experiences. And so that has allowed us to say, okay, this was really cool. It was our first foray into that opportunity. How can we continue to develop and grow that? Because there is funding out there. There are opportunities out there to really elevate the level of care that we can provide our patients. So how can we kind of get more involved in these different things? And so that's something that also the Institute is looking at as well, is what are the other ways to collaborate? And that's been the core of this company. That's been the core of our people. It's part of our culture is kind of what I'm getting at, is we truly believe in collaboration, whether it's provider collaboration, patient collaboration, pharmacist collaboration, right? And it's not just with us. Like, we have our team, we have a great culture, a great environment of the things that we do, and it's exciting. Our team is amazing. They do amazing stuff day in and day out. And yeah, we're not your traditional independent community pharmacy, but at the core of what we do, it's collaboration, and it's really working with other folks to elevate the level of care that we're providing to our patients at the end of the day.
Yeah. So again, a lot of that translates over to the CPESN group, and being able to show, that impact and that unity across a clinically integrated network. And that's really impressive to payers to see that standardized and to see that collaboration and network that, okay, this is something that we can invest in. I remember a couple years ago just being so excited to see the possibilities with like Marixa and Outcomes, where payers are looking to spend money where they can move the needle with independent pharmacies. And so, I think at this point, hopefully everybody's familiar with CPESN. If you are not, strongly recommend you go to the website, check out the local networks, and reach out, get in touch with somebody in your state. But something that I think everyone may not be aware of is all of the work that you guys are doing with special purpose networks. And you kind of mentioned a couple of those. You mentioned the Big Tree, the Health Equity. There's the Emergent. You guys have a couple of these going on. So tell me a little bit about what those special purpose networks are, what's coming down the pipeline in those.
Yeah, no, great question. And so I'll echo real quick kind of what you were saying. I think the thing with CPESN, and when folks are looking at it, right, it's kind of where's the value? And I'll be honest, when I first came on board, I didn't understand CPESN. It was this kind of ethereal concept to me of like, wait, what is it that they're trying to do? They're trying to aggregate people. Like it initially, you're just kind of like, wait, what's the opportunity? What's the value?
Yeah.
But as you get into, value-based care, and as you get into understanding where payers are going for solutions, right? Again, if you're just one independent pioneer that's approaching a payer, right? Yeah, they'll like the concept or whatever, but what's the impact to that, right? It's the number of patients that are in your Pioneer system, right? It's the number of patients that are in your system, right? Like, it's like, okay, well, to a payer, that's okay. That may be great. It might be a nice little side project, right? But how are they going to get the biggest impact with the financials that they're trying to invest in, right? That's really what, to me, it comes down to. So what CPESN does in looking to aggregate our entities and show that there's a standard with which pharmacies that are a part of our network have to meet these particular standards, and that we can deliver success across the board with what we're doing with X number of patients, the conversation becomes very different. So I myself, look, I'm not the brightest crayon in the box by any means, but when I have those aha moments, they are great. And so me having that aha moment with CPESN was really kind of where I really felt we needed to continue to engage and evolve the things that we're doing. And I think that's what's exciting with what CPESN is doing, is they're evolving the service and the level of support that they can provide pharmacies with these SPNs, the special purpose networks. So there are kind of two entities. There's special purpose networks, and then there's kind of special purpose efforts, right? And so there are service sets that they're offering that I think pharmacies can engage in that can help even just their business right away with like CPESN, it's called like business intelligence. And there are analytics that entity can help support in the independent community pharmacies on what's happening with their a business analytics that I think is very valuable. And it's something that like the insights that I think you get are very meaningful there. But the special purpose networks, when we started, we were kind of in that core group of special purpose networks that they were bringing on board. And essentially what a special purpose network is it's an opportunity, it's a program, it's a business model or something. It's an opportunity where the CPSN pharmacies can affiliate with that network and begin engaging in those service sets. It doesn't require that a payer necessarily be there to develop a business model around. Now, ours is because we're using Medicare as kind of the base, if you will. But so, for example, CPSN Health Equity, they're looking to educate and train on getting community health workers across pharmacies, and whether it's locally or across the nation, and being able to then aggregate that community health worker group to then go to payers to say, hey, we have this network of community health workers to deliver on X, Y, and Z. So the opportunities are there because the payers are looking for it. How do we solve X, Y, and Z problem, right? And I think a lot of these payers, they're trying to create pathways through primary care and other entities that don't have the capacity, and they're not looking at a network that already exists. They're not looking at independent community pharmacies as a solution because they're looking at us dispensing. They're looking at us counting by five still. So this is, I think, being a very big transformational change where when we're engaging in these models, when we're engaging in these special purpose networks, there's a different discussion that can now be had because not only are we engaging, we're actually leveraging this. We're doing stuff. We're collecting data. We're collecting outcomes, right? We're getting to where we're providing results that can then have a different conversation with the payers. And it's not just an ethereal, we're working on it or we're piloting it or whatever. It's no, hey, these are actions that are happening. These are things that are happening in the community pharmacy. So health equity is one. CPSN Big Tree is another special purpose network that if you are a community pharmacy and you know, independent community pharmacy, and you are looking to engage with your patients, maybe you have a patient population that you see maybe either low socioeconomic and they really don't have insurance, or they're wanting to pay cash for their services. So DPC is not a new model, but being able to bring it into an independent community pharmacy, that is a relatively newer concept. And so that's what Big Tree does is they basically have a system that they've built. And so Dr. Adam Wheeler is kind of the head of that program, and him and his team, they will embed a DPC practice in a CPSN independent community pharmacy. And so now you have a nurse practitioner who can see patients, and they have a whole model and scale built out to, what needs to happen and what you need to do, and the revenue model and rev share that's there to do that. And so, and they have it to where they've designed the model both in states where you can own your practice, and in states where you technically can't own a practice if you're if you're a pharmacy owner. So like in North Carolina, right, we can't own a medical practice, right, but we can collaborate in a way that we can then have that practice as part of our entity, right? And so Ashley Moose actually she just opened up the Big Tree medical practice in Moose Pharmacy at their location there in Mount Pleasant. So she's kind of really leading the way here in North Carolina for that. So I'm super excited. I'm super jealous of what she's doing, but I'm super excited that she's engaging in that model. And then of course I mentioned what we're doing with PPC at home. So those were kind of the initial SPNs that were on board. Recently there was LTC at home, so long-term care at home has been added. There are a couple of others that are coming down the pipeline that are focusing on other opportunities for independent community pharmacies to engage in. I think there's one that's focusing on medical billing opportunities. That is getting ready to kind of come together here shortly. So what I would tell everyone, if you're listening in on this podcast, is if you're coming to NCPA, all of the special purpose networks and special purpose efforts will be there. We will all be there. We're actually being very fortunate for the relationship we have with NCPA. There's going to be we're going to be on the show floor. We're going to be actually doing a lot of presentations by a lot of our members. I think there's some showcases that are happening. So I would tell anyone, if any of this sounds interesting or exciting to you, or you want to learn more, or you just want to communicate around the opportunities that there are, please, please, please come visit us. Because I think this NCPA show, I'm actually really excited because there's a lot of cool things that we're trying to get out there, that we're trying to showcase what we could do, what the opportunities are for independent community pharmacies to not only just survive, but thrive, right? We need to get from where we're surviving to thriving. And I know there's a lot coming up. A lot of folks are concerned about Q1 and the double DIR that may be hitting, and what are things that are doing. So that's why I'm excited about CPSN, because it's not just hey, we're waiting for X, Y, and Z to happen. No, these are actionable items that you can engage in today that can generate revenue for you right now, right? We're not waiting on something to happen. We're building an infrastructure. We're building an ecosystem within these community pharmacies, right? Kind of going back to what I said before, how do we keep our patients in our own healthcare ecosystem? How do we not let them escape to these other things? We have to continue to innovate. We have to continue to be creative. We have to continue to offer services that our competitors are getting into or getting ready to offer. And we have to be creative in how we do that. And we have to think outside the box. So most states have their own CPESN network currently, right? But then even if your state doesn't have one, there's still CPESN national. Yeah.
And then
if you're in a state that doesn't have a CPSN network, one, definitely reach out to them, because we're always continuing to wanting to grow and expand the opportunities there. And that Ashley and her team and what they do and what CPSN USA does. And so they're always looking to grow and educate on those fronts. But I would also say there are other states locally that you can be a part of to get that support, to be a part of that network. So a neighboring state, for example, might be a network that you consider joining to help engage in the CPSN network as a whole. So
go to the website, look at the network map. You can find the luminary contact, so you can reach out. Definitely recommend everybody checks that out. We're coming up on time. Before I let you go, though, there has been so many interesting headlines recently. This week has been a mess in the world of pharmacy. So this week we had 12 Kansas City CVS locations close. We had CVS announce that they're going to close 900 locations by 2024, so 10% reduction. Rite Aid is closing 400 to 500 in their bankruptcy. Walgreens is looking at closing about 150. A lot going on in the grocery store markets as well, with Aldi and Winn-Dixie and Kroger and Albertsons. It is a really crazy time across retail too. I mean, if you leave the world of pharmacy and just look at retail, so many crazy closings and headlines in major cities, and pharmacy specifically, there is a lot going on right now. So personally, I think if I were playing, all sides of the industry, I would make sure my stores are staffed. It seems like from a strategic standpoint, I'm not sure where you want to weigh in on that, but I mean, with so much going on, where do you see, where do you see opportunities for independent pharmacies to fill those gaps and to, really keep things moving and keep those patients served, as there's complete chaos in pharmacy right now?
It is. And I think, so this is like the $1 million question, right? I think a lot of pharmacies, okay, they see that the local CVS just closed, right? And you say, okay, so, all of those patients are going to be looking for a new home, right? And so what are the other opportunities in that community that can help support them? right? So the immediate thought process is, oh, let's jump on the bandwagon. Let's try to, market, even though we're the worst marketers on the face of the planet, but let's market ourselves, right? To get those patients to come by. And they probably already know that you're in the community and you exist and whatever. But then the challenge becomes, okay, we're adding this volume. Can we manage it? Do we have the resources? Do we support it? And then are we actually generating revenue from the patients that are coming on board because of what's happening, right? And so for the bigger entities, right, the retail entities that are closing down, I mean, yeah, it's really unfortunate for those patients. But if you look at the conglomerate ecosystem as a whole, right, it doesn't really affect them that much, right? They're not going to bed at night saying, oh, woe is me, we just closed 900 stores. They're just looking to see how do we reinvest so that we can acquire these patients in other ways, right? Now, in pharmacy, we kind of have to look at that in a similar light as, okay, there's a pool of patients. It's a race to acquisition of lives, as I said before. So how do we do that? How do you do it strategically? How do you do it so that you can continue to not only just, strain your staffs as strained as they already are, but how can you engage in them? And I think it goes back to what we were talking about earlier about if you're acquiring patients, how do you optimize that patient, right? So when you're looking, obviously, you know that these patients were at CVS, right? You know what insurances that they have, or, whatever pharmacy that they're at. You kind of know what insurances that they have. Most of them were probably driven to go that way, do the mail order thing with them and all that. So you kind of have an idea. So if you're that pharmacy, what happens when you're acquiring? I don't think it's as simple as just, hey, we're going to take all these patients and we're going to help them. You have to be very strategic about how you do it. I do completely agree about the concept of, and you got to figure out how to successfully staff your pharmacies to be able to manage that patient load. But it goes back to what we were talking about before. Yeah, you're staffing your patients, but are you you're staffing your pharmacy to take care of those patients, but are you staffing them at a loss, right? Are you staffing them for 100 scripts that you're losing on, right? So the game has changed for us entirely. That sadly, it's not just as easy as flipping the light switch on and letting everybody in. And so I think you have to be strategic. Now, that being said, we've spent the last 45 minutes talking about all these other wealth of opportunities to engage patients on that, the patient's not tied to a script anymore, right? Like this podcast says, how are you going beyond the script to now bring those patients in? So if I'm an independent community pharmacy owner and I see that these pharmacies are closing down, what am I doing or what have I done that's going to entice that patient and not only come and get their prescriptions from us, but even if I'm filling them at a loss, am I doing other things? Do I have a broader OTC section that's now supporting that patient base? Do I have a wellness program where I can do diabetes education or other things with them? Am I doing other things to now support those patients that when they come in, the totality of that patient's care isn't just the value, if you will, the financial value isn't just tied to a script. It's tied to a script and the wealth of service opportunities that I can engage in, right? Can I ensure that I have the resources to support the staff to make sure they get their flu shot, right? I just recently did a CE around the upcoming potential triple-demic, right? COVID, RSV, flu, right? This is the first time in our era history here that we've had vaccines for all three, right? So are we optimizing on that, right? And COVID, everybody knows that it's new COVID vaccine formulations that are coming out to address the new variants that are out there. And even here in the Southeast, COVID's actually on the rise. So I myself am anxious to get my COVID vaccine because, COVID's on the rise here. But I have two parents that are over the age of 65 that have multiple comorbid conditions. I'm anxious for them to get the RSV vaccine, right? And on top of that, making sure they get their flu shot. So with these opportunities, and I know I'm focusing in on just vaccines right now, but that's one of many service sets, right? So when you're looking at a patient, are we just looking at their script volume? Oh, Mrs. Smith from CVS now has 20 scripts that we can bring in. Okay, well, 20 scripts is great, but 17 of those 20 scripts we're losing on, right? So
right. That's why they were at CVS.
Yeah, you got to now look at the economics differently in what you're doing. So I I don't think this is going to change. I think that there is a culture shift happening in pharmacy as well too, where I think that, a lot of light has been shed with local boards of pharmacy around workplace conditions and the challenges that are happening there. I think tremendous light is being shed. I think you sent me that article yesterday with the oversight committee on PBMs and what's happening there. There's more spotlight on PBM reform and what's happening. I've heard more in the last 2 years since Rutledge versus PCMA and what's happening there, what happened there in the PBM reform and what's happening. And so people are becoming more and more aware. Now, the sad part is it's not happening fast enough for it to impact making sure that independent community pharmacies don't close their doors. But how do we do the other things? How do we engage in other pieces that the business model isn't just based on prescriptions, right? They're not based on a product. And so that's where I feel like in the communities, we have to deliver care locally. We have to be able to be not just a pharmacy, like a dispensing hub. We have to be a healthcare hub. We have to be a center of healthcare excellence for these patients. So we have to engage in a multitude of ways to care for these patients. And, when you look at it across the board, a lot of these patients are looking for support. They're looking for opportunities. We just haven't had the time to ask them. We're asking them so many other things. We're addressing their medication needs. But and what's cool about the program that I mentioned earlier, Will, with Health Game Plan and PPC at Home, I was introduced to a concept called the 4Ms, and it's a model with which when we're working with this patient population, we're looking at 4 things: mobility, medication, mentation or their functional capacity, and the last M is a trick. It's what matters, right? So what matters to the patient? So many times we've got these patients coming in and, you have small talk and you're talking with them and you jump right into your consultation points to ensure they have what they need and whatever. Are we asking these patients, or are we addressing what matters to these patients? And I think that right there is the greatest opportunity for independent community pharmacies. If we can address what matters to that patient, what are their challenges? What are their barriers? What are the social determinants of health that they're experiencing? It doesn't matter what the other entities are doing, whether they're closing down or doing whatever. That patient becomes a patient for life because you're addressing things that really nobody else in the healthcare ecosystem has.
Yeah, what's a win for that patient? If you can tap into an individual patient's value system, there you go.
Absolutely. And so, it's a simple concept. The model is a simple concept, but when you start to practice it, right? It's just like, when the doctor tells you to go exercise, you hear, okay, I need to go. I probably should walk a few thousand steps a day, or I need to get on elliptical or whatever. We hear it, but where independent community pharmacies can really thrive, and why I'm really excited about not only just the offerings of CPSN, but what we're doing at Avant and PPC at Home, is that we're able to engage patients in ways that they need to be held accountable, right? They're looking for accountability. They're looking for that support, right? And they go to primary care thinking they're going to get that, but primary care is just so busy. There's too many patients for them to do that. So unless they're in a particular program or in a particular plan, they're not getting that regular follow-up. And we all know, all independent pharmacies know the statistics, right? You're seeing that primary care doc 2 to 3, maybe 4 times a year. You're in your pharmacy 8, 9, 10, 11, 12 times a month. Year, just the touch points that can happen. So how do we capitalize on that, right? How do we engage? And now, how do we utilize the resources that we have, right? Leveraging technology, leveraging what COVID has kind of done, right? And patients are used to actually having care at home, right? They couldn't get to hospitals. So where did they turn to? They couldn't get to the hospital. They came to their local pharmacy, or we were delivering to their homes. We were giving vaccines in their homes and whatever it might be. We were creating clinic opportunities for them to do these things. So that to me is the opportunity for pharmacies it is unfortunate that these pharmacies are shutting down. And I do feel bad for the pharmacists and the staff that are a part of these entities, right?
Yeah, of
But,
course.
where one door closes, another one should open. And it's not like there aren't other opportunities on the horizon. We spent the last 50 minutes now talking about all of these other things. So I would hope that, there are opportunities for those pharmacies to look to see how to engage in these different things. And I would probably imagine that a lot of independent community pharmacies are looking for help, right?
Yeah, with that influx of patients.
You're looking for help. So why not, reach out and see who are the folks that fit your culture, that fit the environment that you've built and can help support you in that way. And I think that, it is unfortunate that these things are happening. And I think we're going to see a lot more of that. Unfortunately, I think that the kind of the business model and the infrastructure for these bigger entities is probably going to lend to that. But if I'm an independent community pharmacy owner, how do I now prepare my pharmacy to be ready for those challenges and for this influx that's potentially there?
Well, it's also a great opportunity to prepare those patients that when one of those new patients is coming into your pharmacy, to kind of reframe what pharmacy does and reset expectations for those new patients, so that when you do offer those services, they're expecting that you do things differently than the last pharmacy they were at, because you've started those conversations early. You've started to retrain that patient that our relationship is going to be different and better, and we're going to help you with a lot more than just your prescriptions.
Yeah, and I think that's the interesting thing for a lot of the community pharmacists that are in retail. They crave that. They've been wanting to do that. I was in retail previously, so I understand the challenges and frustrations that the pharmacists and the staff are having with the current climate and the current model that they're working in. And it is a struggle a lot of times, because these patients do need an extra layer of care. They need that support, right? I was talking about it before where, again, it's that 20% that are really high risk, that are creating a lot of the challenges, that are being rehospitalized, right? Imagine if they're going to their community pharmacy and they had that extra level of care, right? And I think that's where I think there is a concern for independent community pharmacies from the perspective of, why is it that the retail entities are getting into primary care? Why is it that they're looking at home health? It's only a matter of time before they shift into the service sets that we're advocating for and encouraging pharmacies to be a part of, because now, right, they can engage those patients in a way that their patients are now in their ecosystem and they're not going anywhere else.
All right. So if you're watching at home, make sure that you're keeping those patients engaged in your pharmacy and your network, and grow your network with partners that can help you. So reach out to CPSN, reach out to Swat and the Avant Institute. We'll make sure we put some of those links down in the show notes. Looking forward to seeing you at NCPA. Always good to see you. I always look for you across the show floor. Where's that warm, familiar smile at? I'm going to go shake hands and see the CPESN crew. So I'm going to let you get back to it, man. Thanks for joining me.
Yeah, not a problem. Thanks for the opportunity to be on. It's always an honor and a privilege when you get asked to do these things, but it's always exciting to, be with a peer and a colleague to talk about all the great stuff. And thanks for all the hard work you guys are doing at Pioneer and all the innovation that you guys come up with. I know our team keeps y'all on your toes because we always have a lot of ask, but that's because we love pushing the envelope, and it's great to have a collaborator like you guys that allows us to push the envelope with the things that we're doing. So thank you guys for all of that and everything you do as well.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.